Jonathan was a wonderful young man from a very early age, compassionate, smart, loving. Our family did go through many moves. We lived all over this country, overseas. So that was, I think, tough for Jonathan.
Jonathan Winnefeld was born into an accomplished family. His father, James, rose through the naval ranks to become the vice chairman of the Joint Chiefs of Staff in 2011. By that time, Jonathan was struggling.
At one point, he was in 5 different school districts in 6 years, which is tough for a kid. And so what became apparent to us over time was that Jonathan, as great a kid as he was suffering from some form of anxiety and depression.
Unfortunately, Jonathan was misdiagnosed with attention deficit disorder and prescribed Adderall, a powerful stimulant. Soon, to unwind at night, he began to drink. To calm his anxiety, he used Xanax, a mild tranquilizer, and smoked pot. Then, he experimented with heroin.
So we got him into counseling, and I did what a normal parent would do. I took away the Xbox, I took away his phone, I monitored all of his moves. In retrospect, it was probably the worst thing I could have done for him because it isolated him even more.
And ultimately, he tried to take his own life. He ended up wrapping his car around a telephone pole. It was at that point when we realized that we needed to get Jonathan into inpatient treatment, or we were going to lose him.
I went on the internet and searched, and it's overwhelming. There are so many different places out there. You don't know who's good, who's bad, who's just trying to make money. Financially, our insurance covered nothing. We really tried to find the best treatment possible out there. But in America, there's not a lot of support in the mental health, and especially in substance abuse.
The Winnefelds found a center in Connecticut to treat Jonathan's addiction and anxiety. Like some 80% of programs, it followed the 12-step model of Alcoholics Anonymous, where patients admit they are powerless over drugs, need help from a higher power, and commit to abstinence.
If we look at the legacy treatments that have been around for 70 years, they revolve around going to meetings and working through the 12 steps, generally doing that a lot with self-help and group-based therapy, and then maintaining that abstinence by using that alone.
Jonathan's treatment for 15 months cost the Winnefelds hundreds of thousands of dollars, but it seemed worth it.
Our son came back to us. We were able to have a real conversation with him. We saw about a year into his treatment that he regained his ambition.
Seeming confident of his recovery, Jonathan enrolled as a freshman at the University of Denver.
That day we dropped him off at his dorm. He was excited, looking good, fired up, and it was one of the best moments of my life, seeing him doing so well.
3 days later, their hopes were shattered.
I was not prepared to get a phone call saying that my son had passed away in his bed, in his dorm room, from heroin and fentanyl. Never would have guessed that in a million years.
With failure rates nearing 80 to 90%, is the abstinence-based approach to opioid addiction scientifically flawed?
Abstinence-based programs really, for opioid use disorder, are setting people up to fail and to relapse. And in the face of this crisis, where we know that every single time that somebody uses an opioid, they are at real risk of overdosing and dying, this should never be recommended as a primary intervention.